So good morning, ladies and gentlemen. I'm Dr. Shu from Beijing, China, Fuwai Hospital, National Center for Cardiovascular Diseases. So I'd like to thank a lot for Professor Mohammed. It's a friendship from a long time. It's my great pleasure to be here the second time. Today, just according to the arrangement, let me talk about the fenestration technique. Okay. So I have nothing to declare. As we know, the different situation of the whole aortic arch, including the pathology, including the anatomy, so we need the individual treatment. But we know anyway, let's take a look at data from my hospital when we find it. We have used the different kind of method. You know, many years ago, we focused on parallel sling graft. Nowadays, we pay much attention to fenestration. So that's nowadays the well-accepted the device in China, including the Chimney, including the in situ fenestration, on table fenestration, and bronch stent graft. So Chimney technique, for example, at the beginning, for me, the first time to do is 2007. We already published a paper to treat the dissection. It's our first paper to talk about the dissection case treated by parallel stent graft. Anyway, we can use technique to rebuild not only one branch vessel, but also 3 branch vessels. But nowadays, the concept changed a lot. Let me take a look at such kind of disease. In the special anatomy, till now, we do believe that for such kind of situation, Chimney is still the very important method. You can suppose if we do it by in situ or on table fenestration, it's not a good case. Also, if we design the bronch stent graft, it's easy to suffer from the birth peak. So the best method to this one is still Chimney. Let me show you some special cases treated by Chimney. So you may find it. This technique, you can do it very smoothly to get a very good instant result, especially to the aged people. For example, this gentleman already done TIVR before, but now he suffered from severe chest pain. Come back to my hospital, then we do it by Chimney to rebuild the bronch vessels so quickly within 1.5 hours. Then the patient keeps so well. But the most complication of Chimney is the endoleak. Although the mild endoleak, it can automatically stop in a few months. But anyway, we designed the special device, the Longit with a lab tech. We designed this special slinger for many years. Nowadays, it's already been done in multi-center investigation. The first case, including in Indonesia, we do it very quickly within just half an hour to finish the whole procedure to get a very good result. Nowadays in China, we already finished 115 cases, the multi-center investigation. We find it can reduce the endoleak. Also, the long-term patency of the bronch stent graft is perfect. So that's a result we have done. With this technique, you may find it no matter the immediate result and the midterm result, it's perfect. So that's 1 year's the follow-up. You may find it's a very good device. So it will be available soon, not only in China, but also in Europe. So that's a case to be done by Longit stent graft. You may find it's very convenient for you to do it. Then no matter dissection, PAU, or any reason, even the LSA split into pieces, then you can do it very freely to get the very good result by Longit stent graft. Another endo procedure in China is the fenestration. So we already performed the in situ fenestration and in vitro fenestration. The first case for me to do on table fenestration is 2007. we already published a paper with the 3 fenestration of the whole aortic arch. It's the first one to do the 3 bronchial fenestration in the world. So finally, we destinate to a special device. It's from Acuna. Why? Because this device, it contains a very special mark, including in the big cave, it contains a 8 mark and a supporting bar. In the small curve, it contains a 0. So this device is very easy for you to make fenestration. You needn't situ any marks. So we do it very quickly. Usually within 5 minutes, we make the fenestration and reassembling the device. Then you can deploy directly to the aortic arch. So that's a case we have done. We already deliver such kind of procedure to different countries. So you may find it, that's the 2 bronchial fenestration. We finish the 2 fenestration within 1 hour, only 1 exercise from the femoral artery. So that's special for the vertebral artery. It's just separate from the aortic arch. That's the only method you can preserve the vertebral artery in the same time. So we do it very freely from the femoral exercise. Then you cannulate from the fenestration area to deploy the bronchial graft step by step. So that's a 3 bronchial reconstruction, including the aneurysm and dissections. So we do it very freely. For example, this is an emergency case, the female to be punctured by the knife. So we do the on-table fenestration immediately, and he recovered back the second day. It's a very good case for us to do it. We already practice this technique in different countries. We invite 8 different countries. We have done the procedure. Also, we published the paper together. It's a multi-center investigation. So this technique is well accepted in different countries. I go to the different countries to do it. Then we may find it, the results perfect. Another one is if the aortic arch exists severe angulation, we prefer the in situ fenestration. We designed the C-skirt. You know, CS is my lane. I use this device to treat the patient, including the big stent graft. In the big cave, less stent, more graft. In the small curve, more stent. So it's much better for you to do in situ fenestration. Then you deploy the skirt, like the lady's skirt. The skirt can prevent endoleak. So you use this device in combination with a puncture needle to finish the whole procedure. So we have already done the multi-center investigation in China to get the very good result. There are 120 cases to be involved in this multi-center investigation. We may find it, the endoleak is less. Also, the follow-up is perfect. We have 2 different kinds of puncture needle. One is a Bolen puncture needle. Another one is bending puncture system. Bending puncture system contains 1 catheter, including 2 lumen, 1 lumen with a binding well, another lumen with a puncture needle. So we do it freely to the patients. For example, this one, we use a skirt. You may find it's very freely if we deploy the skirt stent graft inside to get the very good result, no matter the dissection or the aneurysm. So that's a case we have done with a binding puncture system. So you may find it from this device, the binding well to the descending aorta, the puncture needle from the same catheter puncture to the graft. Then you can use a balloon to balloon it. Then to return back the catheter, then deploy the bronch stent graft inside. It's very easy for you to finish the whole procedure to get a very good result. Sorry, this one cannot. In fact, we have done this procedure in different countries in recent months, including the Italy and Germany. So that's a combination with in situ and on-table fenestration to rebuild the left carotid and left subclavian. So we have also used a catheter, this bronch stent graft device. it can freely to isolate an aneurysm, but sometimes uses catheter will get in trouble. For example, this one, the PAU of the small curve. Then we deploy the catheter, you may find it, the standing graft jump inside to the small curve, to the PAU. So this time, the only method for us to do is the fenestration. We use the cup of the Acuna device, a huge fenestration to preserve the left carotid and left subclavian. You know, the left subclavian already with a catheter, but the large fenestration can let you to put the valve inside the fenestration area to deploy the bronze graft to get a very good instant result. Also, the follow-up is perfect. We add its cuff, only need 15 minutes, very quickly, to finish the whole procedure. So finally, let me talk about the future of the whole aortic arch. This device invented by me in 2012. The patent 2011 is a concave Supernal. The bell stand, the second edge is absorbable. Now, this device already applied in China to get the very good result. So when we find it, the first 11 cases we have done, no complications. Only one case suffered from mild stroke. It's asymptomatic, the mild stroke, because the CT scan, we find it, the mild stroke, but no symptoms. We already finished the film study. Nowadays, it's international multi-center investigation. We already finished some cases in different countries. I hope you'll like it. In the future, I suppose, the whole aortic arch, from the panel string guard to fenestration, lastly to the bronze string guard, it will be the end of the world. Thank you so much. Also, you know, it's my great pleasure to have a great friendship with Egypt. So it's my great honor to come back to here again. In the future, would like to invite you to China. We'll strengthen our friendship. Thank you so much. Thank you.